Here at CASA Mental Health, I work as a therapy support navigator, and a lot of that work involves direct patient contact with kids, families, parents, siblings sometimes, and a lot of that work is either helping them to navigate the healthcare system or doing some direct work with families, things like doing direct on-the-floor work with families and their children. The mental health system can be very confusing, and we are here to help make that less burdensome and help walk you along the way.
Nurses at CASA play a vital role in being able to support families through a really difficult time. Working as a nurse at CASA is definitely a rewarding role because you get to see that you're really making an impact in people's lives. I mean, mental health is something where the symptoms of having a mental health disorder really affect all areas of your life and also affect the child's family. So when you're able to make a difference in a child's life who's experiencing a mental health concern, you really have a big impact.
I am the clinical manager of 2 specialty programs, the trauma program and the family therapy program. In my role, I support and lead 2 exceptional teams to serve our children and families with specific needs. And we work as collaborators to walk alongside our families and help with their healing process.
I'm part of the Indigenous Wellness Support Services team, and among this team, we're actually working alongside our mental health therapists, our psychologists, and we provide programs not just to the adolescents and youth in our organizations, but mainly we're focusing among the Indigenous children that we work with to provide them a holistic program, to provide them the services that could bring them back to their roots, bring them back to their communities, and bring them back to their identity as Indigenous peoples. So the importance of the Indigenous Knowledge Day events that we've had previously in the past is actually in part of CASA's commitment and efforts in reconciliation. CASA is making a commitment with these events and wanting to promote Indigenous awareness and the importance of bringing culture within the programs.
I love my job because I love my team. I love the people that I work with. In CASA, what I've experienced is that there is an absolute dedication for growth.
It's really special to work for CASA because you really get to take the things that you're good at and the things that you're interested in and apply those to the work that you do.
I have had the opportunity to work with an amazing team with our dedication to be able to provide these programs and services to the children that we're going to be working with, to the families that we're going to be working with.
I've always really enjoyed working here at CASA, even beyond just my clinical role here. I've always felt very well supported. There's been lots of opportunities for advancing my education and my knowledge.
We started in Edmonton, but because we're hearing the needs from our community members, we're actually expanding to Calgary, north and south of Calgary, and really looking at province-wide what the needs are. We want to make sure that every family gets free mental health care.
If, as a nurse, you want to work somewhere where you can still have your work-life balance while helping patients and families, then CASA is a great place to work.
If you're looking for community and for growth, CASA is a place to be.